Let's now talk about neck pain. Neck pain is a really common issue we see, and there can be a variety of reasons why you might be having neck pain. It could be because of a muscle injury, it could be because of a joint problem, it could be a nerve problem, it could be stress, it could be tension. So there's a variety of reasons, but we do know that a common thing that we see is a lot of people that have neck pain, and the longer it goes on, the more pronounced this deficit is, that they have really poor upper neck flexors. So we sit a lot throughout the course of our day, right? And as we sit at our computer, in our car, or whatever it is, in school, whatever we're doing, right, our shoulders round forward. A lot of people know that. But think about the position that also puts my neck. Now my jaw kind of juts forward, and I kind of slightly go into a little bit of an extension, and how much tension that puts in the back of my neck. This looks uncomfortable. It is uncomfortable, right? So a lot of people know get those shoulders back and sit up tall. What they don't know is to get that head into a good position. Right? So that upper neck flexion is just that little bit of that nod where you're bringing your chin kind of down towards your throat. Right? It is not a common exercise that people know is neck retraction, where they work on pulling that head back. Right? And that's part of it. That's more of a progression of it. So let's start with just the neck, upper neck cervical flexion part first. So the best way we'd like to teach it is laying down, because it's a safe position. People tolerate it very well. And from this position, what I want to cue people to do is tuck that chin down into their throat. So it's just that. It's not a big movement, but what we need to do is learn to build endurance with it. And so we really want to start people just doing that motion first, getting used to it. And a lot of times that will actually loosen up part of the upper neck quite a bit. This will be really good with people that are having headaches that are coming from the neck. They need to get movement in that area. They've learned to lock that area and not move it. So as we get that turned on more, we want to start to learn to get some endurance with it. So we really want to get our goal up to like 10-second holds for 10 repetitions. Your breathing should stay normal throughout this. This is not a breath holding activity. So we just tuck that chin down to the throat and we hold that there. Now, as we get good at that, we can start to progress it, where we maybe start to go into that upper cervical flexion, followed by actually lifting the head off the bed just a little bit. Right? And notice how it's a sequence, right? I flex that upper part of my neck, and then I lift the rest of my head up, release the rest of my head, and now release the upper part of my neck. Right? So I need to learn to get that cervical flexion to stabilize it first. The other part that people might try to do is they do the upper cervical flexion first, and then followed by the retraction, where now I'm pushing my head straight down towards the floor. Right? And learning to hold that position. I flex the upper part of my neck. Now I push down to the ground, hold that, and relax it, and relax it. So sometimes people will go right into that cervical retraction position before they get that upper cervical flexion activation. So if I'm in this position and I try to do a retraction, that's just reinforcing my bad habit, right? I need to get that chin down to the throat first, and then pull back my head towards the ground. Right? That'll help a lot of people with neck pain. It's a good way to start. It's relatively safe. People don't have too much adverse reaction to it as long as they're within their limits. So if it feels like it's painful, back down off it, make it less intense, do it for a shorter duration, take more rest. It's not a big movement. It's not important how far you go. It's important that you get that muscle to activate. That's a good place for people to start with that have chronic neck conditions. After they maybe have seen somebody to get some pain under control, that's a really great exercise to start helping them get better control over that neck so it doesn't come back.